So what about this for a conversation on a Saturday afternoon? We've talked about the study. Yes, give it up for our presenters so far, our panelists, our experts. The conversations that we've been having today are not usually had. So I want to congratulate all of you that are staying and learning and involved in this. I know it's been a long afternoon. I appreciate so much our panelists, your candid discussions, your willingness to put yourselves out there. You're about to hear our last two experts from amazing women. So Wendy Teague, I want you to understand, she was told she would not, probably on a good day, she'd use a walker, but she was confined to a wheelchair. She'll tell you honestly, she was wearing diapers. And she wasn't supposed to live. And I want, and I'm going to give up my seat for her daughter in a minute because you have to hear from these two amazing women. Wendy, can you come up here, please?
Thank you, and thank you for asking me to share what I call my Lyme blessing. So, August of 2011, my daughter Delaney tried to wake me up, and she couldn't do it. She got scared. And I could feel her. I knew she was trying to wake me up, and I was trying to respond. She ran over, she got my father. I could barely open my eyes, and to open my eyes, it was like 1,000 lumen lights were shining in my eyes, so I couldn't open my eyes. I couldn't speak, and I couldn't move. So my father puts me in the car, takes me to the emergency room. I thought in my medical mind, as you heard Marco say, I've been a paramedic for almost 25 years, I thought I was having a stroke. I thought this was the end. I'm a single mom, and it's just her and I. And I get to the emergency department, which they knew me. They had known me for years. I was in there almost every other day. And when I say that, let me clarify that. That was either as a paramedic or a law enforcement officer, because my background is also, I was on a special operations team. It's our version of SWAT. I was the only female. So I was either in there bringing a patient, either in handcuffs or on my stretcher. So a friend of mine, a dear friend of mine that I trained with, I'd actually talked him into being my SWAT team medical director. We trained together. We trained martial arts together. He knew me very well. And before he came on duty, I remember them saying something about a spinal tap. And if you know anything about a spinal tap, it's supposed to be extremely painful. Well, I don't remember anything, but I remember being able to open my eyes, and I said, whatever you just did, do it again. And they're like, Jesus, Wendy, we knew you were nuts, but really, who asked for a second spinal tap? And I said, well, the pressure relieved in my brain. You've got to do something. So they started me on these tests. Did I have pseudotumorite? All of these things going on, and I didn't. D comes in, and he's looking over everything. Now, remember, I'd known this man for 5 years, and we had trained very heavily together. And he said, Wendy, you have Lyme disease, and we're admitting you. And I said, Lyme disease? Didn't I treat my dog for that? I mean, how did I get Lyme disease? He said, well, it's tick-borne illness. Most people know it as that. It's actually a blood-borne pathogen, and anything that bites one host and goes to another can transmit it. So I'm starting there in the middle of my journey. I want to give you a little bit of insight before that. Now, I didn't just wake up one day, I had gotten bit by a tick, and the next morning, I couldn't move, talk, or see. That's not how Lyme disease happens. I always said that I never had anything wrong with me until I turned 30 and started having babies. But I had 2 children back to back. They're 12 months apart. And that lowered my immune system enough for the Lyme that I'm sure I'd already been exposed to actually take over my body. But my background, I was in the Marine Corps. I was a Russian linguist in the Marine Corps. When I got out, I found pre-hospital medicine, absolutely loved it. It was still the adrenaline junkie in me to do that. Went into law enforcement. It was kind of a natural progression that I loved there. And as I was raising my children, my oldest daughter passed away, so at 9 months old at daycare. So all of these things, doctors were saying, you know, eventually that I'd had traumatic events in my life, and all of this led up to eventually me not wanting to get out of bed or live anymore, and that's not the case. But my body was slowly starting to decline, and I had been a runner. I was a marathon runner. I worked out. I was the only female on the special operations team. I worked out. I bench pressed. I mean, I was in the best shape of my life. Nothing got me down, ever. So I received this diagnosis. Now, at the time, I had had a shoulder injury and some other injuries from running, and I was going out on a call out one night at 2 a.m., and I'm taking my daughter over to my parents' house. Had a hostage situation. Not only was I a sniper, I was also a negotiator and the paramedic tactical. It got a little complicated at the time. She looks up at me and she says, "Mommy, can you please not go get the bad guy tonight?" And I said, "You know what, baby, I'm just gonna go one more time." And it was after that I thought, you know, all of this, I was 38 years old, all of the physicality was getting the best of me, and when you have those blue eyes looking at you, you know, it's like, okay, it's time to hold up my shield. So when I was hospitalized, I was actually the director of an air ambulance service. I ran a helicopter service and had all of northeastern Oklahoma. So I spent almost 2 weeks in the hospital, IV antibiotics, and I thought, okay, great. I get out of the hospital, and yeah, I get out of the hospital, and I was not feeling better after all of these antibiotics. Well, I didn't have time for that. I didn't have time for much because I had to go. I had stuff to do. So I got into Mayo Clinic, and I was hospitalized August. I was there in November, and I was there for 6 weeks. They did these battery of tests. My liver enzymes were through the roof, but nothing jives with Lyme disease, right? So 1 minute you have your ALT, ASTBU, and all of these liver enzymes, they're completely through the roof, and then they just seem to correct themselves. So they wanted to say that I was a drug seeker. Well, I'm not a drug seeker. I have a whole safe in my office full of drugs. I mean, you know, instead of listening to their banter, no offense, experts, but I could have been home on a Valium drip if I wanted to. So I wasn't getting anywhere very quickly and didn't have time for that. So I go home. Now, I do want to segue back for a minute. 4 weeks before I was hospitalized, I was starting to write down my signs and symptoms, and they did not make sense at all. And I was starting to lose my mind, and I thought, what in the world is going on? Well, stress, I have a stressful job, you do too much, you're a single mom, all of these things. But I couldn't find my house anymore without GPS. Now, I've been all over the world, lived all over the world, and for the first time in my life, I had to use GPS to go to family property that I had been going to for 38 years. Couldn't find it. I would get lost, had no clue driving down the road where I was. I knew I was in Oklahoma, didn't know. So this slow progression. So I started seeing a primary care. I was never sick in my life, by the way, so I really didn't have a primary care, just an OBGYN. And my headaches started getting worse to the point that I couldn't function. Now, I do suffer a little bit from ADD. You know, my mind is always going at a squirrel. You know, I think of something else, I'm writing it down. But I no longer had the ability to carry on a conversation. My daughter would ask me a question, and it might come out with, "In the kitchen," and that was my answer. I couldn't remember the question that she asked me. I didn't know where I was going with it. And here's this little girl looking at me like, "In the kitchen what?" You know, so my family, once you've been sick for a certain amount of time, they start making assumptions of what's going on. Oh, you need to eat better. Oh, you just need to juice. if you would just get up and take a shower, you would feel better. Yeah, I'd feel better. Can you put me in there and turn on the water? Because when I say that I physically could not do something, I could not do it. I would fall out of my bed onto the floor and low crawl to the bathroom. When I say that my skin hurt, I would have these flare-ups where I felt like I had road rash all over my body. Someone was pouring alcohol on me and setting me on fire. And I would have to take all my clothes off. I had a leather sofa, and I would just have to lay there and turn the fan on to get airflow, just so I would not go crazy. How do you explain that to a physician? That one day, I feel like someone's setting me on fire, and 2 days later it's gone, but my right knee hurts. And 3 days later, it's moved to my left knee and I can't walk. I developed drop foot, which means I would try to walk and I couldn't move my foot, so I would trip all the time. And I had so many head injuries. I don't even know how many head injuries that I had. And when I talk about pain, let me describe to you my pain scale of 1 to 10. When I hit a 10, I pass out. I would try to stand up because I felt the urge to go to the bathroom, which I later found out, and this is so humiliating for me, that I ended up having to wear diapers, because once the urge hit my brain, it was too late. But I would try to get up, and everybody's had a toe cramp or a cramp in your calf. All of my muscles would cramp up at the same time, and the pain was so unbearable, I would pass out. In the meantime, my 8-year-old daughter is coming home from school and finding me passed out, and she couldn't wake me up sometimes. My parents didn't know what to do because I always had an answer. Even if it was, I don't know, but I'll find out, I had an answer because I had amazing friends that I could call on and ask, and so not having an answer wasn't an answer. So I got to a very dark place. Friends, I couldn't enjoy life. I couldn't leave the house. I had anxiety so bad. Now, I had driven ambulances in my police car, there's none around, in excess of 140 miles an hour, right? If your hair's not blowing, there's no point. And I come from a long line of race car drivers. But the thought, even touching my car keys, and the thought of sitting behind the wheel of that car, I would have to talk myself down, and I would sit in a corner, and I would calm myself down and say, okay, I don't have to go do it today. So I became confined to my house. I couldn't walk. My dad brought me over. He had tears in his eyes. And he brought my grandmother, who passed away, brought me her walker and said, just try today. And I said, Dad, if I could, I would. So I got to a very, very dark place. It's okay, baby. I wasn't a parent. She was afraid to come home, and thank God I had built my house next door to my parents up the hill across a little stream. We lived on 180 acres of horse and cattle. Was I exposed to ticks? Yeah, my entire life. I wasn't a mom. What kind of mom can't hug her own child? She was afraid to hug me. Now, I never told my child not to hug me, but she could feel me wince in pain. But to me, as a mom, if I was going to hurt, I might as well be hugging my child. That's something that you don't mind hurting for. She was afraid to hug me. And I got to this place, and my faith has always been so strong. And when my oldest daughter passed away, my faith got stronger because I knew she was in a better place. And I had this when I was 6 months pregnant with this beautiful youngster. And I knew God had a purpose for me. And there were so many mothers that I was able to help after my own child passed away get through that grief. I knew that I had purpose. But at that moment, I laid there in bed, and I was racked with pain. And pain can literally drive you insane. It can make you crazy. At least in labor, you get a second to breathe, before you go on. I could not find a breath. So not only did I contemplate suicide, but I started the planning of it. And having been in emergency medicine and running on so many suicides, I was trying to be the good daughter and the good mother, so however they could find me, it would be an easy mess to clean up. So, did I need to get plastic and do it in the bathtub? And I'm telling you, I had a plan. But none of them was going to be a way that I could shield her from seeing that. No way that I wrapped myself up in plastic first before I pulled the trigger. So as I'm going through this, one moment of clarity, and I was praying to God, God said, take apart your weapons. So that's exactly what I did, because I couldn't remember hardly anything anyway. So I took my Glock apart in as many pieces as I could get it, and I hid it around the house. I took my shotgun, took all my weapons apart, and hid them around, because I knew I could never remember. Then it got to the point, and I said, God, I know you have a reason for this, but I have no clue what it is, and I don't want to live like this anymore. So would you please take me now or make it go away? One or the other, I don't care. But either take my last breath or get me through this pain. And at that moment, I knew I had to make a choice. Am I going to live, or am I truly going to take my last breath? I said, I can't go out like that. I wasn't raised that way. I didn't go through the Marine Corps to do that. And no part of my being said that that's the way that I was going to go out. Out of being shot at, knives pulled out on me, I was not going out because of a bug. So my family said that I'm the one that found Invita Medical Center in Scottsdale, Arizona. It's integrative medicine. And my sister drove me out there. And after 10 weeks of treatment, IV antibiotics, they also do brain treatments, insulin potentiated therapy, they lower your blood sugar, drugs are allowed to cross the blood-brain barrier. I was actually able to carry on a conversation. I thought it was 2011 and my daughter was 7, but it was actually 2014, and she was 11. So I came home after 10 weeks. My brother drove me home, back to Oklahoma, and I went in and I hugged my parents, and I said, where's Delaney? Where's my daughter? And she was standing there. I didn't recognize her. So coming home from that, I thought, that's okay. I'm resilient. So in good old hard-headed Marine Corps fashion, they said, take it easy, Wendy. You will slowly recover. I started training for just a 5K marathon, right? So after 2 months of eating right, they changed my diet, all these things. I got down to 105 pounds. I had total malabsorption, and I could not hold down food or water. I had to go back. So this was a really big hit, once again, to my ego and how tough am I? And how much was I going to let God take me through this journey. I go back for 14 weeks, left my baby again. I go back for 14 weeks. I had my life back. I could think. I was articulate. I understood the science behind it. I had a purpose, and I was ready to go right back to running that helicopter service. After going back home to Oklahoma, within 4 weeks, I had 7 tick bites, 3 with bullseye rashes. Oh yeah, I got reinfected. I also had my daughter tested and found out that she too had Lyme and had probably been born with it. And I said, that's it. I love you, family, but I'm out. And that's when I picked up and I moved to Phoenix, Arizona. It has been an amazing struggle, an amazing battle. But I call it my Lyme blessing for this reason, that and what I do now. Everything, I went and got certified in everything I needed at my worst moment. Now I'm a licensed massage therapist. Oh, I also went to nursing school way back when too, so RN, paramedic in there too. I'm not an overachiever at all. So now I am a colon hydrotherapist, a licensed massage therapist. I'm a lymphatic specialist, and I work on Lyme and cancer people every single day, and they bless my life tremendously. And I tell them that they're more my therapy than I am theirs. Because not only does it give me validation, because when you come on the other side of that, and let me tell you, it is so exhausting having a disease like Lyme, because I spent all of my time putting my surroundings in logical order. I know, and I was taught that the sky is blue and the grass is green, but when I would look, they were reversed. Nothing made sense. But I knew in order to not be committed by my family, I had to act halfway normal. If I had verbalized and articulated the crazy things that went through my mind, they would have committed me. There are a lot of celebrities. Tommy Hilfiger's daughter was in a mental institution in her teenage years, found out later that she had Lyme. The crazy things that Lyme does to you. I still suffer with some brain effects from that hopefully Sunita is going to help me with. I was multilingual. I was a Russian linguist in the Marine Corps. I also speak German and went to high school in Germany. I was a member of Mensa in the 7th grade. So I did have, I had a pretty good mind. I had a pretty good brain. But to look at a spreadsheet, sometimes it's all I can do to even make sense of that. I know and I can tell you that 4 + 3 = 7. But if I look at it on a sheet of paper, it's 4 and 3 is a symbol. It doesn't compute. So it can be exhausting, but I truly believe that where there is a will, there's a way. And this little girl coming in, and every time that I had formulated my plan, the way that I was going to take myself out and bite that bullet, this little girl came through my door, and she would crawl up in my bed, and she would put her little hands on each side of my face, and she would say, "Mommy, I love you, and I need you." So, by the grace of God and this beautiful presence beside me, I'm here today. And if it gives one person the will to say, okay, I'm going to take one more breath, because sometimes it's not getting through each day. It's not about getting through each hour. Sometimes it's getting through each second and each breath. And if I knew that in the Marine Corps we have a saying, just lean forward. Because when you lean forward, one foot will fall in front of the other, and you will go on. So if you take nothing out of this, and you're just taking that breath, and you're living one day to the next, and one breath to the next, just lean forward, and one foot will fall in front of the other, and you will get through it by the grace of God. Thank you.
Now, she's curing cancer, Pamela. I'm not kidding. And I know you medical doctors are, all the stuff that you guys are doing, she is doing it I can't even explain everything. But questions, please, for our expert.
What a tremendous story. You know, we do Lyme's disease and cancer therapy in my office, and we treat them the same way, because Lyme's and cancer are pretty much the same thing, pretty much. But, you know, all those things that you relate, you can get those with Lyme's, because, you know, the thing about Lyme's disease is once you get it, you always have it. You know, it's like you say you're going to kill the ants in the room. You can never kill all the ants. And Lyme's is such a smart bacteria that it actually protects itself, builds a cocoon around itself so that you can't find it, and it could live for years before it gets activated. And when the condition is right, it will come out. So if you're immunocompromised, or if you have a cold, or you're not feeling well, it could find its opportunity to attack you. And your symptoms that you get from Lyme's disease is usually related to what organs it's attacking. So if it attacks your brain, then you get brain symptoms. If it attacks your muscle, you get muscle symptoms, wherever it does. And so it's always in you, and I have no doubt that your daughter got it when she was born, because they say that Lyme's can't be transmitted, but that's not true. There are lots of families where their daughters and sons get the Lyme's disease. But I think that this was tremendous, and I'm happy that you're helping cancer and Lyme's patients, and I applaud you for what you've gone through. Thanks.
Thank you. Thank you for, in this area of the country, validating and recognizing how severe Lyme is and that you do have to treat it like cancer. From the bottom of my heart, thank you.
Now, Wendy, you were told to get over it.
Yes.
Yeah. So what did the medical community back then? Now, I say we have some exceptional doctors here. I don't think they would have. But what was originally told to you by the medical community?
That I had received 2 weeks of antibiotics, and I was cured, because that's what the CDC says. You receive antibiotic therapy, and it's gone. So everything else is in my head.
And that's the problem. People get Lyme's disease, they go to the doctor, gives them 2 weeks of doxycycline, and tell them that they're cured. Absolutely not. You need IV antibiotics, you need long-term therapy. 1 week, 2 weeks, a month is not enough.
But how did you find your answer after the medical community said, you've got your antibiotics, go home? Now, how did you get
I knew that there was something else wrong with me. We're taught from children to ignore our bodies and not listen. You fall down, shake it off. Don't listen to it. Oh, you're tired? No, you got to suck it up and go on. The Marine Corps has a saying, pain is weakness leaving the body. When in turn, we need to listen to our bodies. Our bodies are divinely made. Our bodies have the inherent knowledge of how to heal itself. The other thing, and thank you for touching on that, was you have to change your diet. Now, I get questions, and people call me from all over the nation, all over the country, and I'll even tell them about my coffee enemas and my detoxing and everything that I do. But when I tell them that they have to change their diet and stop feeding the disease, they're like, it's all snake oil, you're full of it. It's called comfort food for a reason. But if you continue to, and correct me if I'm wrong, all disease is fed by sugar. You keep feeding it, it's just going to grow. So it doesn't matter how much poison you put in your body. The mind-gut connection, the brain-body. I love the panelists that are here today, and thank you for that. But you have to take control of your own life. I didn't care what they said anymore. It wasn't my first round with the doctor.
You see, the problem with physicians is we expect patterns. And if something doesn't follow a pattern, then it's in your head. A pattern. Most diseases follow patterns, but Lyme's disease follows no patterns. And so when you say, this is bothering me, and then this is bothering me, they say it's in your head because it doesn't make any sense. But when it doesn't make any sense is when you have to start thinking outside the box, like Lyme's disease, for that. The other thing about Lyme's disease is that, detox is so important, and most physicians don't understand detox. You ask them about detox, they don't have a clue. But the bottom line is that when you have Lyme's disease, wherever it is, your body attacks it. And basically what your body is doing is putting a pimple wherever a Lyme's disease, wherever a Lyme organism is. So just like you get a pimple on your skin, if you have a Lyme bacteria in the liver, when your body attacks it, it creates a pus pocket in that tissue. And as long as that pus pocket is there, that tissue cannot do its function. So you feel the symptoms of whatever that tissue is. So you could essentially have little pus pockets of Lyme disease in your brain, in your muscle, in your heart, in your lungs, in your kidneys, wherever in your body, and whatever that tissue that's being destroyed normally does, that's the symptoms you're going to get from that area.
I'm not very familiar with Lyme disease, and thanks, Dr. Williams, for enlightening the whole group. So I learned a lot today. Also wanted to find out what diet do you advise, and what diet do you follow?
No sugar. I stay away from dairy. I was riddled with so many allergies at one time. There were only 5 things that I could really nourish my body with. It was pea protein. So I had to start healing my gut. I was on the anti-candida diet to kill the candida in my gut, because it wasn't just bacteria. I was riddled with viruses and fungal, all 3 of them.
And do you know why that is? It's because your body is so busy fighting the Lyme, other things crop up. Just like with cancer, you know, your immune system is so busy fighting the cancer cells, you die of a pneumonia, or you have other things. It's the troops, your troops are being occupied. So therefore, little things that you would normally destroy with your immune system, they get away and they start growing, and so you get candida, you get all the other problems that crop up with it.
So no dairy.
No sugar, no dairy,
dairy.
no gluten.
Okay.
And only foods that were hormone-free, grass-fed, and that would nourish my body. So there's the Candida diet, there's the anti-inflammatory diet. You can probably tell more about dietary, but I just did away with chemicals. Basically, I ate from the produce section,
Sure.
the organic.
Yeah, I mean, the anti-inflammatory. Go ahead.
Y'all have kind of mentioned detoxing of the body. I guess I just wanted to know, why is that important, or what you should do when detoxing?
All right. Detox is probably the most important thing you do in life, in health. When you do number 1 and number 2, you're detoxing your body. When someone's kidney's not functioning, you go on dialysis, because dialysis detoxes, cleans. So detox is cleaning your body. When you shower, you're detoxing. When you brush your teeth, you're detoxing. So toxicity is what kills you in everything. So when you have Lyme's disease, it's like having in San Antonio, let's say there was 10,000 people died in San Antonio, and no one picked the bodies up. How would the city function? Well, when you have Lyme's disease, you have dead Lyme's bacteria all over your body, and someone's got to remove it. Detoxing is removing those dead bodies from wherever they are, because until those dead bodies are removed, your body cannot repair the tissue that they damaged. So detox, people do coffee enemas. We do something called glutathione, which is in your body. That's what your body uses to clean itself. The liver makes it, and so we give you IV glutathione, or we can give you glutathione as a pill, but we help your liver out because you need a ton of glutathione to help clean up your system. But in addition to that, we do IV nutrition, and we do detox in the IV. We put ozone, we put hydrogen peroxide, we do all kinds of stuff in the IV to kill bacteria and clean your body out.
I also had heavy metals from the Marine Corps, and it took forever to get the uranium out of my system. Foods are natural chelators, colloidal silver. So I took all of these supplements to help chelate or bind to those toxins in my body so I could eliminate them, whether through the kidneys, through the bowels.
So for us, just that, of course, don't have Lyme disease, but are we still supposed to detox?
Absolutely. So I'm a lymphatic specialist, and I could go drone on for hours about that. But our lymphatic system, it's the sewer system of the body. That's what it does. It goes around and it sweeps all of that stuff up. It puts it back into the bloodstream to be filtered out through the liver and the kidneys. So I also have a genetic mutation, which doesn't allow me to detox as well as other people. So I have to be very diligent about that.
Yes, that's methylation is very key to detox. So people have the MTHFR gene, they don't methylate. And when you don't methylate, you cannot detox properly, because most of your toxins are stored in your fat cells. And so they're stored there because they're fat soluble. And so when the fat cells give off the toxins, they cannot get into the bloodstream without being methylated. All methylation means is that you put a carbon with 3 hydrogen on it on top of the toxin, and that makes it water soluble. So you can get into your bloodstream and into your urine and into your stool, get it out of your system. So methylation is one of the key things. That's why a lot of people who don't methylate get breast cancer and things like that. So detox is very, very important.
So,
She wants to know, what would you recommend as a detox?
yes, what I tell my patients first and foremost when they ask me, 1, drink lots of water. 2, stop putting poisonous chemicals in your body, and that's from the aluminum in your deodorant. There are many things. You can go online. There's so much information there. Hydrate yourself so your body is eliminating it, and stop putting the poisons in there.
Yes, and there's another question, and we can get your contact so people have questions.
Yes.
Another question? Yes, please.
What does water with lime or lemon do to the body?
Lemon helps detoxify the liver. You want to go ahead? You want to take that?
It's just, in your body, acidosis is toxins. So all bacteria creates acidosis. If you are diabetic and you go into diabetic ketoacidosis, that's acidity. So in general, acidity is toxins. Alkylation is healthy. So you want to stop taking anything that makes your body more acidic.
Did that answer your question? You should put lemon in your water. It's alkaline to your body.
May I speak as a therapist for 1 second? Please, please do not be your own doctor. Please, yes, educate yourself. Believe in the wellness model that your body knows how to heal, but please get the help of a specialist when it comes to a more complicated issue. Because they really know what they're talking about, and we can get trapped into perhaps harming our body if we're not very careful, because herbal things are just as powerful as drugs. They work, they really do work. So treat yourself well, make sure you get expert help when you're seeking to heal on such a deep level.
Just want you to know one thing. Sugar is probably about the most toxic thing you can put into your body. So if you truly want to detox, get rid of sugar. All right? Sugar is in everything, and it's more addictive to your body than cocaine.
Yeah, just to kind of give you a summary, just to put everything together, why don't I do this? I wanted to wait for your question. Maybe your question would have the answer.
Real quick, no, you're not talking about natural sugar, though. Like sugar in fruits is okay.
Everything you eat has sugar in it. Everything. It's just putting additional sugar in your body. Like if you eat fruit juices, that's pure sugar. So eating natural fruits are okay as long as it's not been tampered with by the food industry. They tamper with everything and make the sugar in it. Plus, the other thing is when you eat fruits, they have the bulk that goes with it, and the bulk decreases the actual sugar content. So when they take the bulk out and give you the juice, then you don't have anything to protect you from the sugar. So anyone of you who have a juicer that throws the bulk on the side, get rid of it. You want a juicer that incorporates everything from the fruit.
Excellent. You're going to stay. All the doctors will stay a little bit for questions, yes? I know they've got more. I want to ask Delaney. I want to ask you a question. How did you, as an 8-year-old, deal with, and still, finding your mother passed out? Like, what was that like, and what can we do to help our children be more resilient?
As an 8-year-old coming home from school and finding your mom passed out on your kitchen floor, it's very scary. Like, at first I thought she was just dead, and I wasn't sure what happened to her. And how I dealt with it, as much as I hate saying this, I didn't, because it was such a scary thought. My mom is the only person I've ever known, other than grandparents and aunts and uncles. She was my main caregiver. I didn't have another parent to, go run to and say, Mommy's being mean to me. I didn't have one of those. She was my only one. So I just tried not to think about it. So I would stay at my grandparents' house, and I would still go check on her occasionally. I was just so scared of what I was going to find, because I didn't know if she'd be passed out again. I didn't know if she wouldn't wake up this time. I didn't know. So it's a very scary thought. It's a very scary feeling, just to not know. And I'm sorry. But as a child, you also don't really understand the concept of death, right? I know when I was a child, I didn't know that people really aged and that you got older and that death eventually happens. So it's really just not knowing. That's what scared me the most. So yeah, it was.
And I know Sunita was going to ask you what it felt like when I came home and I didn't recognize you. I didn't know who you were.
That was a very sad moment for me. Not having your own mother recognize you, when I've only lived with her. That's such a sad feeling. I remember when she asked where I was and I was standing right in front of her, my heart immediately dropped. I was like, Mom, it's only been a few months. Did you already forget about me? In hindsight, for me, that was the moment when I knew that I got my mom back. Because when I was as a child, you also don't really understand what's happening. And my mom used to shield me. She still kind of does, but I'm nosy. She never let me know that she was struggling. That's how I know that my mom is a strong one, and she ain't going down without a fight. And my mom was always working. I saw her more in a uniform than I did in her pajamas. So I guess really seeing her down and out for so long, that was also hard to watch too, because I just wanted to help my mom, and I didn't know how. I had no idea how. I didn't know if I could. Because I wanted to give her a hug, but at the same time I knew that it hurt her. So Mom, she never let me see her struggle. The bills were always paid on time. We always had water, we always had electricity, we always had food. There's just so many things. And to hear your family say, my mom's own brothers and sisters, my aunts and my uncles, and even my grandparents, just to say that, well, why can't she just get up? Well, we're just a little ways down the hill, why can't she just come walk? And it's also frustrating to hear, it was also really frustrating to hear them say that when they were never over there. They never came over to see or to check. on her. So it truly was just her and I. So I tried to help the best I could, the best I knew how, but just with Lyme, there's no way that you can really like cure it or help it. And as an 8, 9, 10-year-old, 11-year-old kid, there's nothing that you can really do. But I'm a lover, so I just thought, well, love can cure everything. So, yes.
Tell us how to live a life. How do we make sense when we're suffering? What did you see your mom do? What have you learned? Tell us how to do that. Could you?
If anything, it taught me how to be strong. And it also taught me that, like Mama said, where there's a will, there is a way. And watching my mom, like, be down and out, and doctors told her that she wasn't going to live or she can't walk. And she just sashays around and she owns the place. That is where I find comfort. That's my mom. I am made from that, so I can do that. And my mama always said, it's not how hard you get knocked down, it's how you get up. So watching her get knocked down so hard and so fast and so sudden, and watching her get right back up and start off where she left, that is where I find my comfort. And that's where I find my strength.